We have a generational opportunity to fix our healthcare system and help people stay healthy for longer. That's why President Trump wants to love and cherish Medicare and Medicaid.
But what I want to know, yes or no, is since you cherish Medicaid, will you agree to oppose cuts in the Medicaid program?
I cherish Medicaid, and I've worked within the Medicaid environment quite extensively, as I highlighted, practicing at Columbia University.
That's not the question, Doctor. The question is, will you oppose cuts to this program you say you cherish? Time's short.
I want to make sure that the patients today and in the future have resources to protect them if they get ill. The way you protect Medicaid is by making sure that it's viable at every level, which includes having enough practitioners to afford the services, paying them enough to do what you request of them, and making sure that patients are able to actually use Medicaid.
Let the record show that I asked a witness who said he cherishes this program, will you agree to oppose cuts? And he would not answer a yes or no.
Care delayed is care denied. Speaking to a surgeon in Florida who said if he had gotten the prior auth like that, the surgery would have been less expensive, the rehab shorter, the patient's outcome better. Your thoughts, your provider, what do we do about prior auth issues in the Medicare Advantage program?
This issue of pre-authorization is a pox on the system. We spend 12% of the healthcare budget on administrative costs. Pre-authorization is misused in some settings. There are about 15,000 procedures that could have pre-authorization. They represent most of the things that are done. Not just operations, but medications that are given, et cetera. Insurance companies today use pre-authorization for about 5,500 of those procedures. But interestingly, not all insurance companies focus on the same things. And we're spending money, wasting money, trying to do a process that should be automated. I would argue we could limit the number of pre-authorized procedures to 1,000.
Can you confirm that you no longer believe that green coffee extract is a miracle weight loss drug?
I never said that medication was a miracle weight loss drug, but I am very...
Can you confirm that this was fraudulently marketed and green coffee extract is not a miracle weight loss drug? Yes or no?
Yes.
Okay, so let's go on to, you promoted a supplement called Raspberry Ketones, claiming that it is, quote, a #1 miracle in a bottle to burn your fat. That's your quote. Will you confirm for the record today that you no longer believe Raspberry Ketones to be a, quote, miracle in a bottle?
There are many things I said on the show I take great pride in the research we did at the time to identify which of these worked and which ones didn't. Many of them are still being researched, like the green coffee bean extract you just mentioned.
So how much were you paid to promote these supplements?
The television show was distributed by Sony Corporation.
How much were you paid to promote the supplements?
I was paid nothing to promote the supplements.
But you promoted them on your show, and there was something called a Dr. Oz effect. You would mention them and the sales would go way up.
That was written about by the press. That was not something that I would talk about on the show.
I will just go on the record that you have been nominated to run the largest health programs, the set of largest health programs in the United States of America. And it seems to me you are still unwilling to take accountability for your promotion of unproven snake oil remedies to millions of your viewers, and that's really concerning.
Since you would oversee Medicaid if confirmed, yes or no, do you believe that families should have to complete government paperwork every single month to prove that they're working just to get health care when they're sick?
The answer to me is I am in favor of work requirements, and I don't believe we should allow...
Do you think a family should have to fill out paperwork every month just to get health care?
I don't think you need to use paperwork to prove a work requirement, and I don't think that should be used as an obstacle, a disingenuous effort to block people from getting on Medicaid. However, I believe we would both probably agree that there's value in work, and it doesn't have to be going to a job. It could be getting an education. It should be showing that you want to contribute to society. Frankly, you could volunteer at Ebenezer Baptist Church, where I did a show with you once. That would, for me, fulfill the requirement.
You'll never get any pushback from me about the value of a work ethic and the purpose that work provides, which is why I think people ought to have health care so they can get back to work.